Nursing care of patients with infections. Infection control is not new to the practice of medicine or nursing. A glance into the history of medicine will clearly reveal that infections have always been a significant source of morbidity and mortality. The contagious nature of certain illnesses is well documented, and rudimentary control measures usually required infected persons to live apart from the non-infected population. Advances in medicine eventually led to the identification of specific disease-producing organisms and mechanisms favorable for disease transmission. These advances led to turn to the development of effective measures to prevent or control the spread of communicable diseases and infections. Every year, many lives are lost because of the spread of infections in hospitals. Healthcare workers can take steps to prevent the spread of infectious diseases. These steps are part of infection control. Proper hand washing is the most effective way to prevent the spread of infections in the hospitals. MRSA versus VRE. MRSA is transmitted primarily by contact with a person who has an infection or is a carrier of the bacteria. The germ can be spread by direct contact with the person or by the hands of someone caring for the person, touching others before hand washing. MRSA can survive for an hour or more on environmental surfaces such as floors, sinks, blood pressure cuffs, but these are not the most likely source of spread. MRSA infection is caused by Staphylococcus aureus bacteria, often called staph. Many years ago, a strain of staph emerged in hospitals that was resistant to the broad-spectrum antibiotics commonly used to treat it. Methicillin resists the Staph aureus. It has been called a superbug by the media because of its multiple drug resistance. MRSA can cause serious, sometimes fatal, infections that resist treatment with all but a few drugs, for example, vancomycin. Some extremely rare strains of MRSA that are resistant even to vancomycin are starting to turn up in some hospitals. VRE, vancomycin resistance enterococci. These are normally found in the bowel and female genital tract. They have been shown to persist in the environment for long periods of time, up to 7 days, on hands, gloves, equipment, and surfaces such as bed rails, telephones, stethoscopes. Cross-infection has been attributed to thermometers, commodes, movement of inadequately cleaned patient furniture. Transmission occurs directly via the hands of healthcare workers or indirectly from contact with contaminated environmental surfaces and patient equipment. Medical asepsis. Clean technique, procedures used to reduce and prevent spread of microorganisms, like hand washing. Surgical asepsis, sterile technique, procedures used to eliminate microorganisms, like sterilization. Hospital-acquired infection. The likelihood of exposure leading to infection depends partly on the characteristics of microorganisms, including resistance to antimicrobial agents and amount of infective material. Urinary tract infections, pneumonia, diarrhea, infections following surgery or invasive medical procedures, and maternal and newborn infections. Wearing of appropriate protective gloves at all times when touching blood, saliva, other body fluids or secretions, mucous membranes, non-intact skin, blood-soiled items or bodily fluid-soiled items, contaminated surfaces, and sterile body areas, and during instrument cleaning and decontamination procedures. Discarding gloves using following treatment of a patient and changing to new gloves if torn or damaged before treatment of a patient, and washing hands prior to performing services for another patient, and washing hands and other skin surfaces immediately if contaminated with blood or other body fluids. The importance of having thorough understanding of infection control principles cannot be overemphasized. Patients entering a healthcare setting are at risk for acquiring infection because of decreased resistance, either as a result of the patient's underlying illness or as a result of specific course of therapy. Other factors increasing the risk of infection include increased exposure to number and types of disease-causing organisms and the need for invasive procedures to be performed. Infection control techniques are designed to prevent the spread of infection from patients, healthcare providers, or visitors, an important part of every action the nurse performs. Therefore, the nurse must become the first line of defense against disease transmissions. There are two sources of infections. Endogenous or self-infection, organisms which are harmless in one site can be pathogenic when transferred to another site, like TB or E. coli. Exogenous or cross-infection, organisms transmitted from another source like a nurse or a doctor, other patient, and environment. Unfortunately, nosocomial infections lead to increased healthcare costs, extended hospital stays, and prolonged recovery time. The organism causing most nosocomial infections usually come from the patient's own body, endogenous flora. They also could come from contact with staph, cross-contamination, contaminated instruments and needles, and the environment, exogenous flora. Because patients are highly mobile and hospital stays are becoming shorter, patients often are discharged before the infection becomes apparent. In fact, a large portion of nosocomial infections in hospitalized patients, and all from ambulatory care facilities, become apparent only after the patients are discharged. The spread of infection is best described as a chain with 6 links. If you break any link on the chain of infection, you can prevent the occurrence of new infection. Infection control measures are designed to break the links and thereby prevent new infections. The chain of infection is the foundation of infection prevention, so we will look at each link and at actions we will take to break it. Pathogen or causative agent. A biological agent organism capable of causing disease. These include bacteria, fungus, fungi, and protozoa. Reservoir. Any person, animal, arthropod, plant, soil, or substance, or a combination of these, in which a causative agent normally lives and multiplies, on which it depends primarily for survival, and where it reproduces in such numbers that it can be transmitted to a susceptible host. Reservoirs are usually wet. Portal of exit. This is the way the causative agent gets out of the reservoir. In a person, this is often by a body fluid, and some bacteria, such as MRSA, can live and grow on the skin. Mode of transmission. Any mechanism by which a pathogen is spread from a source or reservoir to a person. Common modes of transportation include unwashed hands, things which are not clean between patients, droplets, or for a few diseases, the air. Portal of entry. The hole in the skin that allows the infectious agent to get into the body. Common portals of entry include the mouth, nose, eye, rashes, cuts, needle stick injuries, surgical wounds, and IV sites. Susceptible host. A person or animal lacking effective resistance to a particular infectious agent. Common vehicle. Contaminated material, product, or substance that serves as a mode of transmission by which an infectious agent is transported to 2 or more susceptible hosts. Routes of transmission. Airborne. Most people get infections of some sort or another. There are 4 main routes for infections to enter the body: down the respiratory tract into the lungs. Coughs, colds, influenza, and other common airborne infections are contracted in this fashion. From respiratory tract via talking, coughing, sneezing. From the skin by natural shedding of the skin scales during dressing or bed making. From aerosols to equipment, respiratory apparatus, air conditioning, plants. Contact. Breaks in the skin. Only one of many functions of the skin is to act as a barrier against infection. Anything that penetrates the skin, or for that matter the mucosal membrane that lines the mouth or nose, provides a route for infection to enter. Typically, bites, scratches, puncture wounds by needles, etc. increase the risk of infection. To direct contact from person to person, by indirect contact spread via contaminated hands or equipment. Clothing of staff, urinary catheters, contaminated with hands of the operator may introduce organisms, or patient's own flora from urethra may contribute to infection. Foodborne. Down the digestive tract, food, drink, and other infected products can be swallowed and infect the stomach or bowels. Most people have experienced an upset stomach, which reveals itself in the form of diarrhea and or vomiting. Bloodborne. Needle sticks and also up the urinary and reproductive systems. The infectious agent may remain localized or may enter the bloodstream. Sexually transmitted diseases most commonly infect the genitals. HIV, the AIDS virus, is carried in bodily fluids and can be transmitted in saliva and seminal fluid or blood. The accidental transmission of infections as HIV, HBV, and HCV by needle stick injuries is documented. So hand washing. Frequent hand washing dries skin, and the skin can break down and crack, breaking our skin barrier protection, so use hand moisturizer frequently. Protection of the patient is priority. However, we must also protect ourselves. As nurses, we are at risk for contact with infectious materials or exposure to a communicable disease. In the single most important procedure for preventing the transfer of microorganisms and therefore preventing the spread of nosocomial infections. The CDC, the Centers for Disease Control and Prevention, recommends 10 to 15 second hand wash. This will remove most transient organisms from the skin. Pull long hair back. Hair falling forward may drop organisms. Keep nails short. No acrylic nails or chipped nail polish. Minimum jewelry. Cover open wounds with an occlusive dressing.